Well, good morning. In recent days, the CDC has updated its vaccine dashboard, so reporting looks a little bit different than it has, but the progress that we're making in Iowa is clear. Our administration rate is strong, and the number of Iowans vaccinated is impressive. The CDC is reporting that Iowa has administered a total of nearly 622,000 vaccine doses to eligible Iowans age 18 and up. 19.2% of all eligible Iowans have at least one dose, and 271,000 Iowans age 65 and up have had at least their first dose, and that's nearly 53% of all Iowans in this age group. And in just the last 7 days, more than 83,000 Iowans have received a vaccine. Nearly 64,000 were first doses. Now that vaccine supply is increasing, our administration rates are steady and allocations are provided weeks in advance. We're finally able to generally answer the question that so many Iowans are asking, and that's, when is it my turn? We can now project when eligible populations could reach critical vaccination milestones and when we might expand access to the next priority groups. Next week, we project that 70% of Tier 1 populations will have received at least one dose of vaccine. And this includes our first responders, K-12 teachers and staff, and child care workers. And we estimate that 70% of Iowans age 65 and older will have received their first dose of vaccine by mid-March. So this does allow us to plan ahead for the next eligible groups to start. Essential workers and individuals with disabilities living in home settings are expected to start vaccination in early March and achieve the 70% mark in early April. At that time, we could again expand to the next eligible group. As you saw in the graphic, once a group becomes eligible, they remain eligible. There isn't a cutoff date for any population. But because we can project when 70% of individuals in a group have received at least one dose, we can plan based on allocations when to begin vaccinating the next population. But I want to reiterate that projections are just estimates, and these are intended to provide Iowans with a sense of how long it will take to vaccinate each population and when vaccine could open up further. They're not hard dates, and some areas of the state will be able to transition to their next eligible population more quickly than others. So, of course, timelines will vary county by county. Some will need additional time based on the size of their populations, and estimates could change for a variety of other reasons. Just as we experienced last week, even events in other parts of the country can impact vaccine administration in Iowa. On Tuesday, the White House held its weekly COVID-19 briefing for governors and provided an update on vaccine delays resulting from last week's severe weather in some areas of the United States. By the end of last week, shipping delays resulted in 6 million doses being backlogged. So additional shifts were added at distribution points to clear the backlog and ensure that this week's supply was moved as quickly as possible. Since the weekend, more than 15 million doses were shipped nationwide. We were told on the call that the backlog would be cleared as of yesterday and current allocations should be completed by tomorrow. Because of the delays, deliveries have been running late in counties across Iowa, which unfortunately delayed vaccination clinics in many communities. However, now that supply is back on track, I know that our local public health and other vaccine providers are working diligently to catch up quickly. And I want to take a moment to thank them for managing through just this, through the situation. During the White House call, we also learned that the federal vaccine allocation for states will again increase by another 1 million doses. And beginning next week, they hope to forecast state allocations from anywhere up to 2 to 3 months in advance, which we all know will be very helpful in providing that certainty and planning. And although we're still waiting on the FDA's final approval of the Johnson & Johnson vaccine, plans are already underway to distribute it nationwide as soon as possible. They're anticipating that an initial 2 million doses will be available nationally. And we just confirmed this morning that 25,800 doses will be sent to Iowa in our initial allocation next week. And Johnson & Johnson, this was brought up in the call as well, has announced its goal to produce 20 million doses by the end of March, and they have signed a contract with the federal government to provide 100 million doses by the end of June. So news of another vaccine becoming available and weekly allocations continuing to increase means that soon even more people can be vaccinated across the country and right here at home. I'm cautiously optimistic that the progress we're seeing now will only continue, and I do appreciate the partnership of the federal government in helping make this possible. The progress we've made over the last several weeks is pushing us toward a turning point in our COVID-19 recovery, and I'm committed to continuing this forward momentum in Iowa. So one of the ways that we can do this is by making the vaccination process as easy as possible for Iowans. While limited supply has had an impact on appointment availability, this will improve as our vaccine allocations increase. Still, Iowans need a reliable source of vaccine information specific to our state so that they know when they're eligible and what to do to get vaccinated. Tomorrow, we'll be launching a new website with the latest information you need to know. Vaccinate.iowa.gov will provide information about eligibility resources available to assist Iowans and answers to frequently asked questions. It will also include a vaccine locator so you can find providers near you, click through to their websites to check availability and to get details about scheduling. But I want to be clear, you cannot schedule an appointment on this site or register to be contacted when scheduling is available, but it will connect you to a provider for scheduling in their system. And of course, that's going to become easier as the supply continues to increase. So right now it is, strictly one of the issues has been supply. However, vaccinate.iowa.gov will help you better understand and again navigate the process and hopefully answer some of those frequently asked questions. Information on the site will be updated often, and everything on the site can be translated into numerous languages so that it is accessible to Iowans of all backgrounds. The website is just one of the solutions that we're putting in place to better assist Iowans. Older Iowans make up almost 18% of our total state population, and we all know that this is the population that's most vulnerable to serious illness and hospitalization from COVID-19. So it's absolutely critical that they're vaccinated as soon as possible to protect their health and allow them to finally get back to doing things they enjoy without worrying about the virus. But the vaccine process is largely managed online. And that's proven to be challenging for some of our older Iowans who may not have a computer or for those who have difficulty using one. To help, we're establishing a dedicated team of vaccine navigators through the 211 call center to schedule appointments for Iowans age 65 and older who are unable to do so because of technology barriers. This service will be available starting the week of March 8th, and I'll share more information on that in just a few minutes. In the meantime, some vaccine navigators will start tomorrow by contacting older Iowans who have reached out to their area agencies on aging for help scheduling an appointment. And I want to thank all that they've done throughout the pandemic to serve older Iowans for their partnership over the last few weeks. They've identified hundreds of individuals who need help and creating a waiting list so that we can assist them in getting an appointment. Today, I am pleased to welcome Joe Sample, Executive Director of the Iowa Association of Area Agencies on Aging, to share more about how the organization serves older Iowans, including throughout this pandemic. So, Joe?
Thank you, Governor Reynolds, for the opportunity to collaborate with your office, state agencies, and community-based partners who are working to provide support and assistance to older Iowans. Until recently, many Iowans may not have even heard much about an Iowa Area Agency on Aging. The Area Agencies on Aging are defined under the Older Americans Act of 1965 and became established in Iowa in the early 1970s. Iowa's 6 Area Agencies on Aging are part of what's called the Aging Network, and this includes the Iowa Department on Aging and hundreds of home and community-based providers that serve older Iowans, family caregivers, and individuals with disabilities across the state. Some of the key programs that the Area Agencies on Aging provide or fund are programs you may be familiar with, such as home-delivered meals, senior dining sites, or even some case management support. In addition to the health and nutrition programs and other activities that promote optimal aging and independence for older Iowans in their communities of choice, the network also provides information and assistance to Iowans over the age of 60, adults with disabilities, and those serving as caregivers or care partners, as well as the general public. In the last few weeks, providing information and assistance regarding the vaccination process has been a key component of our network's public service. Older Iowans who have called an Area Agency on Aging have been provided information about the necessary steps in scheduling a vaccination, including initially calling their local pharmacy, their local primary care provider, or their county public health office. As our information and assistance specialists more about the needs of the callers, we determine if they have exhausted their options or for vaccination scheduling, and are they technologically disadvantaged related to the devices they're using, available broadband, or even just the skills in using those technologies. If this is the case, we get permission to share that individual's contact information with scheduling entities for vaccination, and in this case, such as 211 as we move forward. Additionally, we explore whether the individual may be interested and eligible for other services or need support related to elder abuse prevention and other issues related to social isolation. We make those referrals accordingly. We appreciate the attention being given to scheduling vaccinations for older Iowans. COVID-19 is indeed an ageist virus, as 93% of the COVID-related deaths in Iowa have been individuals over the age of 60. We encourage older Iowans to continue their patience as vaccines become more readily available, as well as encourage older Iowans to get the vaccine when you can. Finally, I want to remind older Iowans that scammers are actively attempting to sell you access to getting the vaccine. Please remain diligent in not providing your personal or financial information, such as your Social Security number, your credit card, or your date of birth to anyone who calls you, texts you, or emails you for that information so that they can somehow get you access through an extra payment mechanism to the vaccine. The vaccine is free of charge, so please do not share your personal information. We also want to thank this year's General Assembly for its ongoing efforts to address elder abuse and financial exploitation in Iowa. Governor Reynolds, I thank you again for the opportunity to collaborate with your office, Health, and the Iowa Department on Aging in responding to the needs of older Iowans. Iowa's Area Agencies on Aging have been here since before the pandemic, and we are ready to continue our innovative services throughout the pandemic and well into the future. Thank you for the opportunity to share our story.
Oh, thanks, Joe. I really appreciate you taking the time to be on, and we are so grateful to everything the agencies have done to serve older Iowans throughout this challenging time, and really not even outside of what we've experienced over the last year. And we're really looking forward to working through the wait list and helping vaccinated as soon as possible. So thanks for helping us make that happen. We really appreciate it. So I also want to take this opportunity to thank Iowa's 211 call center. You know, they've played a big role since the start of the pandemic, answering Iowans' questions about COVID-19 and directing them to the resources they need. Now that role is expanding even further with the addition of dedicated vaccine navigators to assist older Iowans who need help in scheduling an appointment. It's important that Iowans understand that this service is only for adults aged 65 and older who are truly in need of scheduling support. It's intended to help those who don't have access to a computer or aren't comfortable using one, individuals who may not have anyone who can assist, or for others who have tried to get an appointment but still haven't been successful. Starting the week of March 8th, Iowans 65 and up can call 211 and speak with a vaccine navigator who will ask them some questions and take some very basic information, including their name and birth date, so that they can schedule an appointment for them at a nearby Hy-Vee pharmacy. I also want to thank Hy-Vee for being a part of the solution to ensure that every older Iowan can get vaccinated. This is a tremendous team effort and another shining example of Iowans stepping up and helping each other when there's a need. At next week's press conference, I'll share more details about how this process will work, including what you can expect if you call for scheduling assistance and what you'll need to do at your appointment. In the meantime, don't call 211 yet to schedule an appointment. Vaccine navigators are working through next week to schedule appointments for those who were added to the wait list that was created by the Area Agencies on Aging. If your name is on the wait list and you receive a call from a 211 vaccine navigator to schedule an appointment, they will only ask you to confirm your name, birth date, and county of residence. They will not ask for your health insurance information, Social Security, or credit card number. These items are absolutely not necessary to schedule an appointment. So as you heard, if someone calls you and asks for this information over the phone, do not give it to them. They are not a 211 vaccine navigator. But you will need to provide that insurance information to Hy-Vee when you check in at your appointment. So this is only needed so that the insurance company can follow up with the vaccine, to pay for your vaccine provider, their administration fee. There's no out-of-pocket expense for you. Vaccines are provided free of charge. So once more, to wrap up, a new informational website will be launched tomorrow at vaccinate.iowa.gov. And starting the week of March 8th, Iowans 65 and older can call 211 for assistance with scheduling a vaccine appointment. So I look forward to sharing more information next week. And with that, I'll open it up for questions.
Governor, is the state still planning to produce a centralized scheduling and registration system? And is there a timeline for that?
No, so what we're doing is we're working with our existing providers, so this will be kind of a one-stop shop that you'll eventually be able to go on, similar to what they're doing nationally. Put in your zip code, it'll tell you providers within a certain range, and then you'll be able to schedule directly through their website. So that's be right now with the process.
Could you, I'm going to try to sneak in a two-parter. One is a math one.
Okay.
You're welcome.
Yeah.
The Johnson & Johnson, so the 25,000 plus that the state gets starting next week, do you know what do you know the breakdown for all three of the vaccines will be for that? And then secondarily, what's the process for whether a person gets Pfizer, Moderna, or now Johnson & Johnson?
So I called Liz Matney, who's kind of a policy, the vaccine policy person on my team, and I asked her what was the amount of doses that we'll be getting this week. It was 91,100. So Dave, we continue to see those increase a little bit each week. Of that, Johnson & Johnson, I think, was 25,800. And I'm not sure, Kelly, maybe you know, I don't think there's any specifications on which one. It's just, you know, originally we had Pfizer kind of going to the larger areas because of the storage requirements. They're still determining if that's still necessary. So we saw most of the Moderna kind of go outside to more of our rural areas. The nice thing about Johnson & Johnson is it's a single dose. So right now we're anticipating really utilizing the Johnson & Johnson for our next phase, which is, essential workers in food and our manufacturing companies. Again, that will allow us to get in to schedule. It'll be a single dose, and we can work through that tier group, I think, at a pretty good rate by really taking advantage of Johnson & Johnson to do that. Did I answer everything, Dave? Okay.
That's it.
Governor, can we talk about the voting bill a little bit? You've heard from your Democratic friends who say it's a voter suppression bill. And I'm just wondering, if you give folks less time to vote and fewer opportunities to vote, how is that good for democracy?
Yeah, well, I think, I haven't had a chance. We're reviewing it right now, so I'll probably give you the same perspective that I give when you all ask where I weigh in on a bill. It goes through the process. I don't weigh in unless it's one of the bills that I'm sponsoring, and then once that makes it through both chambers with the same language, it's sent to my office. My team does a thorough review of the bill, and then we set down pros, cons, what it actually does, and so we'll be in the process of doing that, and we'll take a lot of the conversation that happened throughout the legislative process into account. But so we'll weigh all of those issues and make a determination going forward.
Governor, if I may follow up, did you see any problems with this last election that needed to be solved?
You know what? I think we do it well in Iowa. I'm proud of our system. I think we're a role model for other states, but we should always be looking at ways that we can enhance and I said that, way early on, but the fact of the matter is there are Americans across this state that have some concerns about what happened in this last election. And again, I think it's imperative that it's not just understood, but they feel that there's integrity in the election process and they feel that it's fair and it's done in an equitable manner. And so we'll take a look at the legislation that passed and we'll make a determination moving forward.
Governor, there's legislation that would apply sanctions to state incentives for tech companies if they're deemed to be suppressing free speech. Not asking about that bill maybe specifically, but more broadly, do you have any concern that something like that could be could scare off or be upsetting to a company, including some of those major companies have located here in Iowa in recent years?
Yeah, actually, the same comment applies. This is part of the legislative process. The bill has just been filed. Iowans, businesses, tech companies will have an opportunity to weigh in on that bill. I do understand from the legislature, I do understand their frustration with what is censorship on social media and just some of the issues that we're seeing. So I understand their frustration in trying to address this. I hope that we're able to address this at the federal level as well. But again, we'll let it work through the process and we'll see where it ends up. And after we've done a thorough review, we'll be able to comment on the legislation. But I do understand their frustration.
What sort of signal would it send to the business community, the Googles, the Facebooks, the Apples, Tim Cook, who you appeared with in August of 2017, if the state says, just kidding, you don't get those hundreds of millions of dollars of incentives to be here? Yeah,
I think that's a discussion that needs to be had in the legislature. That's questions that they should be answering. But it's no different. I mean, they go in and they attend hearings at the federal level and they're asked those very questions. So this is an opportunity through a bill that's been filed. This is for.
Governor, when I checked the CDC site this morning, and I don't know if this has changed since then, but Iowa was one of 3 states, I think, that had fewer than 5% of the population that had both doses. Is there any reason for that? I mean, is there a lag between the ability to get the second dose or get both doses into arms in Iowa?
Yeah, I don't know if that's accurate, David. I haven't looked at there is just a timeline from when you receive the first dose, when you're supposed to get the second dose. So, Kelly, I don't know if you have any additional information on that. I'm not aware of that. Before when we had looked, we were actually up at the top for the allocation of second doses. So I would have to check on that and I'll have my team get back to you, but has not been the case, when I looked before, but I didn't check this morning. And here's the deal. They are changing the way that they're displaying the information, and that is a result of governors being so frustrated with the way that they were presenting the numbers, and it wasn't accurate because we didn't have any control over the long-term care partnership. We don't have any control over the retail partnership. Those numbers coming in and when they're allocated, as well as the FQHC, those numbers are outside of our control as well. And so with the long-term care partnership, we had them setting on some unused vaccines, and that was going into the overall projection, and we had absolutely no say or insight into that data. And so call after call, we ask for them to change what that looked like. And to their credit, they did. But it's still, I think, going to need some work. And so we'll continue to work on that and take a look at it, and I'll have somebody follow up with you.
Thank you.
How big do you think, I think you said 91,000 here, how big in your mind do we need to get for a weekly guaranteed supply where you see us potentially doing what some other states are doing where they kind of bring in the guard to use some other assistance, but do these mass sites, maybe through Test Iowa or whatever, where you're really shuttling them through quickly?
Yeah.
Do you see that happening?
It's a numbers game right now. I mean, I appreciate them wanting to send FEMA in and help. If they want to bring the vaccines with them, we're all about that. But right now, we're a rural state, and so as we see our numbers increase, we're already reaching out to a lot of our private sector partners, some of our communities, to talk about how we can stand up some mass vaccination clinics. UIHC was able to get to 2,000 a day. I think you'll start to see more of that. We had some additional doses come in that we're going to allocate to 3 counties, actually Scott, Pott, and Cerro Gordo, for them to do something similar to what you're talking about, Dave. So it's an incentive for other counties. You know, if you can get it through and get them scheduled and get them administered as we see new doses come in, we want to help be a partner in that, and we want to help facilitate that. And so I think, you know, as we see the doses come in and as we do the projections like we're doing now, kind of working through 70% at this point, 70% of essential workers mid-April, we're going to have a better understanding of what that looks like. And if, you know, I don't want to overpromise because, again, things are always subject to change, but right now the projections of additional vaccines and Pfizer being able to ramp up, Johnson & Johnson, you know, I'm optimistic that that's going to really, you know, change. March is going to be a big month, and I think April probably even bigger. So things are going to change, I think, potentially relatively quick. And, you know, just to put that in perspective, it's only been 2.5 months since we've had the vaccines, and it's not even been a year yet since we had our first cases in Iowa. March 8th is when we had our first 3 cases. So I think sometimes we need to step back and just really think about that. It's not even been a year, but yet we've been vaccinating Iowans for 2.5 months, and we have 53% of 65-year-olds and older that have received their first vaccine, 18% of all eligible Iowans 18 and up. So, you know, we're really starting to see a change, and I'm hopeful. Thank you.